So the most commonest things are if there is any kind of a bloated sensation, nausea, vomitings, and if there is any kind of a mild kind of increased vaginal discharge which doesn't have any kind of a foul smelling or any itching or irritation. These are commonest things. Apart from this, you can have easy fatigability, very easy kind of a tiredness, as well as the first and foremost of course is if you miss your period, then that's how we say that you might be pregnant, and from there onwards you need to get all of your investigations done. Once you have a doubt that you might be pregnant, you initially will get it once you miss your period. So that is first and foremost sign of your understanding that maybe you might be pregnant. The important investigations which are required for a confirmation of pregnancy are firstly a urine pregnancy test which can be done at home, but provided you have to do it with your first morning urine sample after 5 to 6 days of missed period. The second one, if you're still in doubt, then that's when we recommend to have a blood test which is called as a beta HCG. Any HCG value which is more than 5 to 20, that's when we say that probably your pregnancy has just started. But around 6 to 7 weeks, if you want to avoid your blood test or if you don't want to do your urine test, you can directly get an ultrasound done, which is done around 6 to 7 weeks of pregnancy, counting from the first day of your last menstrual period. That's when you can do your ultrasound scan, which also confirms what is the location of the pregnancy and how healthy the pregnancy is. See, generally sometimes what happens is if it's a biochemical pregnancy or like biochemical pregnancy in the sense if only mild kind of elevation of the hormone has happened in your body and there is no proper establishment of the pregnancy inside the uterus. That's when we say that probably you can get a very faint line on your urine pregnancy testing kit, and your HCG values are also very mildly elevated, which are around 40 to 50, but later on you get off your period. So this is considered as a biochemical pregnancy or a false positive kind of a pregnancy where you get a mild positive but ultimately it leads to into a period. So that's why it is not considered as a pregnancy. The other things are if the kits are faulty, that is if your urine pregnancy testing kits have been kept in store for a longer time, if they have foregone the date of usage, that is they have expired, then also you can have faulty pregnancy testing as positive. And sometimes what happens is there is something called as menstrual abortions. That is, you get a test as positive, you get your beta HCG values, that is the blood test value is also above 50, but you get your period on time. So these are called as menstrual abortions. That is in case of non-implantation of the pregnancy is not sitting inside the uterus, you get your period on time. The first and foremost important thing that you have to look into basically start is one, a very healthy lifestyle. No smoking, no alcohol, no excessive kind of a physical strain that you have been doing even before. Like if you're into intense kind of workouts, you need to stop them. Then apart from this, trying to have a very healthy lifestyle with good amount of fruits, vegetables, lots of water, hydrating yourself regularly, having small intermittent meals like once in every 2 to 3 hours, and making sure to have a calm kind of a mind so that you don't overstress yourself. This is very, very important. Apart from this, the most important medication during the first starting of pregnancy is folic acid, because any kind of deficiency in folic acid can definitely harm the baby in having improper neural as well as brain development. That's the reason we start off folic acid even before pregnancy, but if not started early, it can be started as soon as you miss your period. Apart from this, it is also important for you to start investigations. If you haven't had any kind of a blood test in the last 3-4 months before you're pregnant, You can always start your immediate investigations about how your general condition is, like your hemoglobin, your blood group, thyroid values, your vitamins, if everything are good or not, for you to have a proper pregnancy and in order to have very less number of complications during your entire pregnancy